2009, obesity was not something that early care and education centers were part of. And the evolution of interest and activity in this area has been striking.
Obesity among 2 to 5-year-olds is decreasing from almost 14% in 2004 to just over 9.5% in 2014. We have to acknowledge the First Lady and all she's done to make children's health a priority. And let's not forget the President's task force and recommendations, where early care and education settings was one of the key pillars for action.
We really need to be leveraging our work and working toward common goals. We know that one organization can't do it alone, so we need to be working together towards some specific goals so that we can help children grow up healthy all over the country.
Everyone has a role to play in reducing child obesity, and this is everyone from the private sector to local elected officials to nonprofits, parents, caregivers, faith-based communities, community-based organizations, you name it, you have a role to play in making a difference.
At our first conference in 2009, very few states were working intensely in healthy eating and physical activity. And now, thanks to our collective efforts, virtually all states are working in this area.
It's never too early to get started, and the early child care and education setting is a natural place to be focusing on those things that will help create healthy children and those things that are going to help create children whose minds are as active and as ready to learn at kindergarten.
It is an opportune time to discuss how our specific roles, whether in research, policy, or practice, can play a part in ensuring that we overcome barriers and that we facilitate healthy weight among our youngest citizens.
To have a child be ready to learn, you have to have a healthy brain. And to have a healthy brain, you have to have healthy eating and physical activity.
Leadership is the primary link between quality and children's health and wellness. You really have to have a leader that's willing to take risks and input new ideas.
We're working forward and working towards this idea of developing an action plan that we can all use and provide input into as we work forward towards this goal of healthier kids and a healthier future.
There are a lot of people who interact with child care. We need to all be on the same page. We need to be talking to each other.
One of the frustrating pieces of early childhood advocacy is that we don't have one early childhood system.
Sustainable improvements to the ECE environment was going to require integrating obesity prevention standards and support for implementation into multiple components of state and local ECE systems, through child care licensing and administrative regulations, through quality rating and improvement systems, through pre-service and professional development systems, through technical assistance networks.
If we want to increase health in early education settings, we've got to think about the health of our employees.
Wellness in the early care and education setting is not just about the kids and the families. It's really about the professionals as well. And that piece about them being role models for the kids is really important.
The first action step is integrating the ideas of health into everything that we do.
We've got to figure out a way of translating these opportunities into things that are easy to do, to the practitioners on the ground at the state level or the local levels.
Really think about what's important to the family, what's in the best interest of the child, what experiences teachers know are best for kids, and how can all of that come together. It's a partnership, it's a relationship.
You have to share your perspective, but you have to understand the perspective of the provider and the parents, and you have to offer information which is clear and actionable, that has steps that are practical, so that people know what they actually have to do once they make a decision that that's what's going to work for them.
You think about where we need to invest our time, energy, and programs, and just technical assistance, it's in those small family homes and those family-friendly neighbors who might be out of the range of our licensing laws to make sure that they have quality care.
And one of the things that we know to be true, and we certainly have to keep front and center when we're talking about child poverty, it's not about just the child, because children do better when families do better. That's absolutely clear. And that if we're talking about addressing childhood obesity among low-income families, we're talking about truly trying to understand the decisions that are made to survive.
For some children to get to the same level, you're going to have to invest a little bit more. That is really uncomfortable for most people, that you've got to invest more in some to get to the same level of result, especially if you're a state leader. And so providing data, providing information that it can make a difference is critical to being able to do it. But if we keep spreading the same services to everybody in the same way, then you still have a lot of children and families that end up being left behind.
It's about reflecting, it's about collaborating and problem solving, and then it's about committing to action. Those three areas or pillars or anchors are the areas that we're really focused on.
Let's Move Childcare has now really become a model on how federal, state, and local leaders work well together for scaled impact. This is incredible. It's why we're here. This is so much success, and we have so much momentum. And this is the time where we have to dig in, dig deeper, get smarter, put more investments together.
Collaboration without action is not meaningful. The timing really is right for action, and it's going to take all of us working together to then align those actions, the federal, the state, and the local actions, to align them, to produce results for children.